These are your evening headlines for August 12th, 2025, right here on BYU-Idaho Radio. Thanks for joining me today. I'm Austin Pace. Community Family Clinic aids communities with healthcare regardless of insurance status. Student reporter Cody Miller has the story.
Since 1971, the Community Council of Idaho has been supporting rural communities around Idaho and has become the largest nonprofit serving Latinos in the state. In Idaho Falls, the council opened a clinic named the Community Family Clinic in 2004. It helps people with or without insurance get the medical care they need. The clinic operates with a sliding scale fee that enables people to pay less per month for medical care. Dr. Joshua Stringham is the Chief Medical Officer and Medical Director for the clinic.
We are working currently to have a foundation in our organization to help even those patients that don't necessarily qualify for the government programs or for other programs, but then we can turn around and help them. So there are limitations even to what we can do, but our limitations are much less compared to a normal clinic.
He said last year they have had the most patients ever at 14,000 people receiving care, and he predicts they will surpass that number this year. After all, they practice what he calls birth to grave, meaning they care for people from pediatric care to elderly care. They have a dentistry, a pharmacy, and more. It's the only kind of center in East Idaho that provides this level of work while using Medicare, Medicaid, or private insurance as a nonprofit to reduce payments to low or even free, all for those who may struggle financially. One way they can help is by reducing the amount people pay for expensive medicines.
There's a diabetic medication that works very well and helps patients a lot. It's called Farxiga, and it's a pill, and it can be $800 to $900 a month if you don't have insurance and you're just paying cash pay. If you qualify for the sliding scale fee in our clinic, you can pay as low as $12 to $15 a month. So $900 versus $12 is pretty darn good. And that's the best thing that I can do, is offer those services and give them to people that really need them.
They accept tax-deductible donations as a federally qualified health center. Dr. Stringham is also a member of the medical residency, so if students need medical experience for a graduate education, there are spots open. For donations, volunteer work, or more, please visit idahocfc.org. For BYU-Idaho Radio, I'm Cody Miller.
The city of Idaho Falls released its proposed budget for the upcoming fiscal year, outlining how $389.6 million will be assigned across 11 departments and key services. Mayor Rebecca Casper said the budget book gives residents a clear look at how property taxes, fees, and other revenues are invested to support essential services and growth. About $52 million, roughly 16% of the total, comes from property taxes, with the rest from utilities, fees, savings, grants, and other sources. According to Local News 8, the budget focuses a lot on public safety, adding money for workers and buildings to keep up with the growing city. It also carefully plans for the future while making sure important services keep running. A public hearing on the proposed budget will be held at 7:30 p.m. on August 14th in City Council Chambers, 680 Park Avenue. Residents can learn more and share comments before the final budget is adopted on August 28th. A $5.1 million donation was made to the Red Cross by the Church of Jesus Christ of Latter-day Saints. The money will help expand blood donation programs and support treatment for sickle cell disease. It will also provide new blood collection equipment across the country. This isn't a new partnership. The Church and the Red Cross have worked together since the Spanish-American War in the late 1890s. Beyond financial support, the Church of Jesus Christ has donated disaster relief kits, hosted nearly 37,000 blood drives over the past 30 years, and provided thousands of volunteers. Since the Church's first blood drive in 1996, the Red Cross has collected more than 1 million units of blood from Latter-day Saints to help patients in need. These have been your BYU-Idaho Radio evening headlines for August 12, 2025. Thanks for tuning in. More news, interviews, and great content are available on our podcast feed. Search for BYU-Idaho Radio on your favorite podcast apps. We're on YouTube, Spotify, Apple Music, and more. For BYU-Idaho Radio, I'm Austin Pace.